Welcome back to Wellness Tips with Dr. Park. Today I'm going to talk about environmental toxins and how they affect the biology of the human frame. Some environmental toxins, and there are many, and this is not intended to be an extensive list of every environmental toxin because there are so many. But I feel like in this day and age, our eyes are open like never before to the effect of the environment on the human frame. Some of these environmental factors include plastics and microplastics, herbicides like glyphosate, heavy metals like mercury and lead, and then even antibiotics. Allergens are another environmental toxin that have a significant effect on development, especially of children, and then cause a lot of harm in adulthood. So I would be talking about dogs and cats and mold, pollen. These things affect how the nose functions. So that environmental toxin actually affects things structurally, which can cause mouth breathing, which can cause the jaws to collapse. So it all fits together in a very interesting sort of interplay of things that can cause harm or create good. There's an example cited in a book by Dr. John Mew of a little boy who got a hamster when he was 8 years old. And you can see his facial changes after he got the hamster. He was developing beautifully, and in his midface and his jaw were growing forward as everyone's should. But once he got the hamster, his nose got stuffy and he had to breathe through his mouth, and that caused a down and forward growth and open mouth posture. And he needed braces. And 90% of Western culture today needs braces because of these environmental influences, namely allergens. Another area that's affected is the human microbiome. And specifically, my area that we'll talk about today is the oral microbiome. One thing that has a profound influence is antibiotics. We're learning more and more today that antibiotics are really good to kill the pathogens, but they're really bad in the sense that they kill the good bacteria as well. And that affects the microbiome, and it throws everything off. And the human microbiome is really covered well by a physician named Dr. William Davis. If you want to look into his research, and he's written a couple of great books about the topic of the human microbiome. Two of the big influencers on the oral microbiome are sugar, which is obvious. We all know sugar is bad. And the second one is mouth breathing. And mouth breathing is a structural thing that can be affected by many things that I've already talked about in previous videos. But what it does is it changes the microbiome in a way it becomes toxic. And it dries everything out. The bacteria in the mouth were never meant to be dry. Everything inside the mouth is meant to be wet and moist. And everything outside the mouth is not meant to be moist. The oral microbiome is made up of millions of bacteria. Most of them are good, and then there are the bad guys. I've already launched into some of that in previous videos, so I'm not going to discuss a lot of them. But we can influence that in a good way by making sure our diet supports a healthy oral microbiome. So some of those things are whole foods and not junk food. So some of the junk food things that are really bad are crackers that dry out and stick to the teeth, and those feed the bacteria that don't belong there. Then there's a whole food that doesn't do that. Like a grape is not going to stick to a tooth the way the cracker is, or a gummy bear or something like that. And we want to make sure that we're feeding the good bacteria and inhibiting the bad bacteria. One of the things that can do that is a sweetener called xylitol. I talked about xylitol in the past, but there are some wonderful things that I want to highlight about xylitol today to help us learn what we can do for the oral microbiome to make a big difference. We've learned that carbohydrates are not so great for you, and we're going to deep dive into the carbohydrate world to talk about things. Sugar, sorbitol, mannitol are all 6-carbon structures that are actually metabolized by the bad bacteria, strep mutans, that causes decay. Xylitol, which is an alternative carbohydrate, is a 5-carbon structure that bacteria can't metabolize. They try to, but it uses all their energy and it ends up destroying the bacteria. So that is how xylitol is a far superior carbohydrate for the mouth and for the oral microbiome, because it's going to kill strep mutans in the mouth. It actually is a substrate for the good bacteria to survive. So if you start to use xylitol, it can become very beneficial. Some other interesting facts about xylitol is that it's actually a naturally occurring sugar. Our body actually makes 5 to 10 grams of xylitol a day. It's found in berries, it's found in birch trees, and it's also found in corn. So it's also important to know the source of your xylitol, because there can be GMO that are used that obviously are not going to be helpful for the body. But xylitol as a whole is a much better carbohydrate for the body than, and for the oral microbiome, than regular sugar is. It's got a lot fewer actual carbohydrates per gram, and it has a lower glycemic index, and again, as I've stated, it doesn't feed the bad bacteria. So the way xylitol works is that it actually uses the bacteria's energy. It blocks the docking stations that the bacteria use to do their harm, and it raises the pH, because the harmful bacteria only work well in an acidic environment. Those docking stations that are blocked actually disrupt the communication between the bacteria, and they can't make their slime that causes the whole milieu of harm to the tooth. So they can't make their, I call them bacterial hotels of tartar, and it just disrupts the whole communication that causes the harm to the tooth. So strep mutans like an acidic environment. That's how it functions best and causes its harm. So the way xylitol works is to raise the pH and to stimulate saliva. And that saliva has so many healing mechanisms for the tooth and for the oral microbiome to be healthy. So the harmful bacteria is actually deactivated, and it's able to just slide down the gut and exit the body. There's been a lot of research on xylitol, and I'm not going to launch into a lot of it, but some things that they have found is that using xylitol regularly actually reduces urinary tract infections. It promotes good gut bacteria. It improves bone strength and collagen during aging, and it contributes to the destruction of yeast or candida. The key to this is to use pure xylitol. If you're going to have xylitol, the best and most effective way that research has found is to use it 5 times a day. That seems like a lot, but it's not all that hard to do. After breakfast, after lunch, after dinner, and then in between meals a couple of times. By doing that, by introducing xylitol in that way, those 5 different ways, you're going to change the oral microbiome, and you're going to feed the good and inhibit the bad. There can be a 70% reduction in dental caries or decay by spreading it out in that way and changing the oral microbiome. Now, I would recommend a particular company for this. There's a really good company owned by Dr. Ellie, and she has Zelly's mints and Zelly's gum. We sell them here at my office because I have found them to be extremely effective, and they're a great source of xylitol. And she has a very prescribed method of using it, as I said, after breakfast, after lunch, after dinner, and then possibly sprinkling throughout the day as well. This video is not meant to be a comprehensive solution for all environmental toxins. There are so many. I've discussed xylitol and how to rebuild the microbiome, but there's something else that God has given us in our system to make a difference, and that's the lymph system. And the lymph, as I've said before in a previous video, and is highly elucidated by Dr. Perry Nicholson, is our body's trash truck. And it helps to decontaminate the body, but our lymph gets clogged. So the best way for the body to deal with things is to get it out through the lymph system. So please refer back to my Big 6 lymph reset, as designed by Dr. Perry Nicholson so brilliantly to help to figure out how to detox your body. There are many disciplines in medicine and dentistry to deal with the toxins that we're exposed to. And this is not meant to be a comprehensive addressing of this topic because it's so vast and influences so many ways and so many things. So it's impossible to make this a comprehensive strategy for avoiding these influencers in our lives, which are the toxins. There are many different ways to deal with it, and I've only addressed one way of dealing with an altered microbiome by using xylitol. And as much as possible, keeping it simple by avoiding a lot of these environmental toxins is a good and healthy way to live. Thank you for watching this video, and I hope you found it informative, helpful, and maybe directive for how to live a healthy life. And if you did, like, comment, and subscribe for more great content.